The news at 6 begins at Bethesda, where a round of 1,000 people gathered today to express their frustration and fear over possible cuts to Medicare, Medicaid, and research at the National Institutes of Health. Thanks for joining us on the news at 6. I'm Larry Miller. You're watching WUSA 9, also streaming on WUSA 9 Plus. For a little context here, employers cut more than 170,000 jobs last month. It represents a 245% increase from January, and it's double the number that was announced during that same month a year ago. The reductions in the federal workforce are causing spikes in unemployment and program fears. John Duran was in Bethesda today speaking with lawmakers, researchers, and one woman who says that NIH gave her an extra year with her dying son.
Tell me what democracy looks like!
This is what democracy looks like!
A demonstration of frustration and fear outside the National Institutes of Health headquarters.
Of our colleagues.
Its doctors worried federal cuts could come for them.
Anything that rattles us, anything that causes uncertainty and throws our work into the abyss, that's a threat to our healthcare and the discoveries that we can make to keep people healthy.
This rally, more personal to some than others.
My son Ethan was 23 years old, and he actually passed away on Tuesday here at the NIH Clinical Center.
Denna McGrew is from Florida, but has spent much of the past 11 months here with her son.
He had a rare disease, and he contracted an infection that turns out impossible to cure.
McGrew says her son arrived at NIH nearly dead. She believes his stay here allowed him to celebrate another birthday and propose to his girlfriend, which he did in January.
More year with him was everything to all of us. And so we have no doubt that he would have passed away at the University of Florida Hospital in March of last year if it were not for the NIH accepting him into the protocol.
Politicians also arrived motivated to defend the work at NIH. Congressman Jamie Raskin says even though a federal judge blocked cuts to medical research, people need to stay vigilant.
I'm a two-time cancer survivor myself, and I know that the lymphoma doctors that I had both worked at NIH and they profited from the research that was done here. So why would we go to war against our own institutions?
Also speaking at Saturday's rally was a doctor who works as a cancer researcher here at the National Institutes of Health. He says they're already feeling the effect of federal cuts.
We can't hire fellows, so there's really no one who's coming through the pipeline to take on new research.
Because of a hiring freeze, McGrew worries that the many people suffering from rare diseases, like her daughter, who has the same immunodeficiency as Ethan, might suffer if cuts come.
We need this research to continue for people like Jenna.
NIH! NIH!
In Bethesda, John Duran, WUSA 9.